Hello everyone. So, in this lecture I am going to discuss about the anti-malarial drugs. In the introduction part we will discuss about what is malaria, then we will see what is the life cycle of the parasite. Yes. After that we will discuss about the drugs which is used to treat malaria. So, let us start with the key facts in this disease. So, malaria is a life threatening disease. Yes. Caused by the parasites, here we are seeing it as Plasmodium, Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. These are the parasites which are transmitted by one vector known as female Anopheles mosquito. Yes, this is the preventable and curable disease. Yes, it will treat the disease at a particular time, then we can cure it. Yes, and of course we have preventable measures as well, okay, like mosquito repellents, yes, using the insecticides, these all we are using for preventing the malaria, and also we have some chemoprophylaxis. Now, in 2019, there were estimated 229 million cases of malaria, and what are the deaths? So, see, it is nearly 4 lakhs in 2019. Children are more prone for this infection, yes, aged less than 5 years, vulnerable group, and in 2019 they are accounted nearly 67% of all malarial deaths worldwide. That is why it is a major concern. Okay. The area where this disease is prominent. So, World Health Organization African region, it is carrying a disproportionately high share, yes, of global malaria burden. So, this area is accountable for nearly 94% of malaria cases and death. Yes. Now, if we will talk about the total funding, so total funding for malaria control and elimination is nearly $3 billion. Yes, it will account it from the total of the funding. So, contribution from the government of endemic countries amounted to $900 million, which is representing nearly 31% of total funding. Yes, so means the major funds are given here. Yes. Now, see the life cycle of malarial parasite. Now, the life cycle of this malaria parasite requires 2 hosts. Yes. So, this is the Plasmodium, and we have 100 of species, but here in humans we are talking for 4 or 5 species. Yes. So, one is your falciparum, then ovale and malariae, and then we have some other species as well. Yes. So, we are talking here for the Plasmodium, which is requiring the 2 hosts. One is the human and another is the mosquito. Which mosquito? Female Anopheles mosquito. In humans, asexual cycle is completed here. Yes. In mosquito, sexual cycle is completed. Yes, now we will see how it is going on. So, it is started from this. Now, mosquito will bite to the host, here host is human, and this mosquito will liberate sporozoids. Yes, these sporozoids is infected form. Yes, it will start the infection in the humans. Now, these sporozoids will reach to the liver first. Yes. In the liver, this is called as the liver stage. In the liver, these sporozoids will undergo the conversion. Yes. In the conversion, they can form trophozoids. Yes. And they can also undergo in a dormant phase, which is called as a hypnozoids. Yes, these are the dormant phase of these sporozoites, yes, where they will stay for a very longer time, they will stay for many years, okay, in a dormant condition, and whenever the immunity is low or all of the condition will favor, the infection will revive again in the humans, okay. So, this is the part of the exoerythrocytic stage, yes, but here we are dealing when the sporozoites will convert to the trophozoites. How they are forming the trophozoites? There are some phases, like it undergoes the ring stage, okay, they are forming the trophozoites, and when these are the merozoites, okay, when these merozoites will come out from the liver, they will undergoes the procedure will undergoes in the RBC. Yes, these are all the RBC stage, the ring stage, trophozoite stage, schizon stage, and they will form the merozoites. Yes, so this is the cycle we can see. Now, these merozoites can form the gametocytes, yes, macrogametes and microgametes, yes. So, these gametocytes, they are formed, and when the mosquito will come and will bite the human, the mosquito will take the gametocytes, yes, and these gametocytes will then again convert into these zygotes, okay, the male and the male and female part, these gametes will form. These gametes will again form the zygote, and this zygote will form the ookinete. In the mosquito, these all phases are means these all phase is occurring in the mosquito, yes, and this is the sexual cycle is completed here. This is all in the humans, this is the asexual cycle, yes. So, see here the ookinete is formed, and they are forming the sporozoite released ruptured oocyst, yes. These oocysts are liberating many of these sporozoites, yes, and these sporozoites are present in the saliva of the mosquito. Whenever the mosquito will again bite the humans, the mosquito will give those of the sporozoites to the humans, and the cycle will start again, yes. So, there is the 3 stages, yes. The first stage is occurring in the liver, the second stage we are seeing in the blood in the RBC, and third stage means the where the these schizons are in the dormant condition and they are staying in the liver, yes, which is the exoerythrocytic stage. So, we will start with the drugs which are used in the treatment and prevention of malaria, and they are classified on the targets where the plasmodium is. So, first is the primary tissue schizontides, yes. So, these drugs are targeting on the liver, okay. Therefore, it is known as pre-erythrocytic stage, yes. Pre-erythrocytic stage means before the RBC. So, firstly schizons are targeting to the liver area, yes. Then from the liver, whatever the conversion is going in the liver, so whatever the new schizons are formed, they will target to the RBC, red blood cells, yes. So, here we are talking for the primary tissue schizons which are targeting the very initial organ, liver. Drugs like proguanil, primaquine and pyrimethamine, yes. These drugs are used for the causal prophylaxis, yes, because we are targeting here the cause, very initial cause where the infection is started. So, it is liver. Now, the second is the erythrocytic schizonticides, means the drugs here are targeting on the RBC, yes. What is happening in the RBC? The plasmodium is digesting the hemoglobin, yes, present in the RBC, and that digestion is eventually or resulted in the weakness of the RBC or the hemolysis of the RBC. And due to this the hemolysis of these RBC, there will be the symptoms appear like fever, chills, rigor, yes, symptoms of the malaria. So, these drugs kill schizons in the blood and can be used for the treatment of acute attacks as well as suppressive prophylaxis of malaria. So, these drugs will suppress the symptoms of the malaria as well. Okay. All these drugs are used for the treatment of malaria, but not for the prophylaxis. Yes, we are assured on the malaria. If it is diagnosed properly by the labs, then only we can start the erythrocytic schizonticides. These drugs can be given. Artemisinin derivatives are very short acting, whereas if we will see the quinine and sulfatoxin, they are toxic on long term administration. So, we have to see, okay, how we will plan the therapy. Now, erythrocytic schizonticides, they are classified on the basis of their action, either they are the fast acting or the slow acting. So, there are two classes. Fast acting drugs are like chloroquine, mepacrine, quinine, mefloquine, helofentrine, atovaquone, artemisinin derivatives. Yes. Slow acting means proguanil, pyrimethamine, sulfonamide, tetracycline. These drugs effect on the, they are targeting on the RBCs and they are slow acting drugs. The third stage is the exoerythrocytic schizonticide stage. Yes. On this stage, this exoerythrocytic stage, what is going on? These schizons are in the dormant phase. Yes, they will stay in the liver, they will stay in the in that area for a very longer time. Yes, and whenever the immunity will be low or condition will be favor to revive the infection, at that time the patient will show the symptoms of the malaria. Yes. So, exoerythrocytic schizonticides, these are the drugs, they will kill the exoerythrocytic forms of the plasmodium. Yes, and thus used for radical cure. So, it will kill the plasmodium, okay, by the uproot of it. Yes, at the time will give these drugs like primaquine. Yes. Now, see, fourth is the sporanticides and gametocides. So, when these gametes are formed, yes, in the human, at that time we are preferring for some drugs, and these drugs will inhibit the formation of these gametes, yes, and ultimately they will prevent the transmission of malaria. So, drugs such as chloroquine, mepacrine, quinine, they can kill the gametes of Plasmodium vivax, yes, whereas proguanil, pyrimethamine, primaquine, artemisinin, they can kill the gametes of vivax as well as falciparum. Now, see, this is the conclusive chart here. So, you can see this sporozoites which is coming in the human body by the bite of the mosquito, female Anopheles mosquito. They are reaching to the site here, blood vessels they are reaching, and in the blood vessels they are first reaching to the liver. Yes. So, this is known as pre-erythrocytic schizogony. Here the drugs are primaquine, proguanil and tetracycline is working. Okay. Then there is a one stage where the conversion of these sporozoites, they will again go to the RBC. Here we can see in the RBC, which is called as a erythrocytic schizogony, and these drugs are working here like chloroquine, quinine, mefloquine, these drugs. Yes. Now, we are seeing from the RBC phase they are the gamete formation. Yes. So, primaquine, chloroquine and quinine is working here, and there is one exoerythrocytic stage which is here. What is going on? The schizons, they are in the dormant condition. Okay. So, they will stay in a particular area of the liver for a longer years. Okay. So, primaquine is effective for the radical cure. Okay. these are the clinical uses. So, pre-erythrocytic stage, the drugs which is targeting on these phases, they are used for the causal prophylaxis. The drugs which are affecting on the erythrocytic stage, they can use for the clinical cure and suppressive cure, because they will also inhibit the they will also reduce the symptoms of the malaria as well. Yes, exoerythrocytic stage means we are killing the dormant phase of Plasmodium as well. So, this is radical cure, used for radical cure. Gametocytic means they are preventing transmission, the drugs which are targeting on the gametocytic stage. Now, see the drug chloroquine. So, chloroquine is a very good drug which is showing the large volume of distribution. Yes, it is accumulating in the Plasmodium, and what it is doing, see, this is the Plasmodium food vacuole, and inside of it there is a hemoglobin. Yes. Now, what Plasmodium is doing, it is digesting the hemoglobin. So, hemoglobin, when it is digested, it will form the heme product, and this heme is a toxic product. Yes, it need to be changed into hemozoin, which is a non-toxic product. Yes. So, for the survival of Plasmodium, this is a normal phenomena which is going on. Now, what chloroquine is doing? Chloroquine will inhibit this part. Yes, the conversion of heme, the toxic product, into the hemozoin. If it is inhibited, of course, there will be toxicity due to the hemozoin and cell will die. Yes. So, see, it prevents polymerization of heme to the hemozoin, resulting in the accumulation of heme. Yes, that is toxic for the parasite. This is the mechanism of chloroquine. Now, see where it is used. It is used for falciparum malaria and chloroquine sensitive falciparum malaria. Yes, it is a erythrocytic schizonticide and has no effect on exoerythrocytic, means the dormant phase of the Plasmodium. It is not showing any effect on that stage. Where it can be used? So, chloroquine has many uses. It is used for autoimmune disorder, rheumatoid arthritis. It is used for the intestinal infection. Yes, it is also used for one of the other autoimmune disorder, discoid lupus erythematosus. Yes, skin allergy will be there, skin infection is there, lepra reaction which is seen in the leprosy. Then infectious mononucleosis. Yes, this is one of the condition caused by the Epstein-Barr virus. Yes, and glandular fever will be there. Yes, so lymph nodes and the spleen, these areas are affected. So, chloroquine is effective on this condition also. Photogenic reaction, sensitivity to the light is there and the allergy is mediated. So, for that chloroquine can be given. Then malaria, of course, what we are reading here, giardiasis is one of the condition caused by the Giardia lamblia, and for that these drugs can be prescribed. Now, what are the adverse effects of chloroquine? So, chloroquine is causing the vasodilation. Yes, and due to the vasodilation, there is a hypotension. Yes, they are also affecting on the T waves, means they are causing the T wave changes in the ECG. So, there will be abnormality in the rhythm. So, there will be myocardial depression. Okay, so chloroquine has effect on the heart. Side effects, yes, myocardial depression, hypotension due to vasodilation, it is affecting the neurons. So, there will be peripheral neuropathy, and due to the peripheral neuropathy there will be CNS effects as well, hallucinations, okay, confusional state. There will be auditory impairment, this is due to these CNS effects, okay, toxic psychosis will be there due to the peripheral neuropathy. Yes, it will use the prolonged for the prolonged time. So, at that time it can cause some vision abnormality. Yes, vision problem will be there. So, prolonged use of high doses can result in the blindness due to one condition called as bull eye maculopathy. Yes, so eye will be appeared as bull. In this, what is going on? The normal retinal pigment will be depigmented, yes, which is surrounded by a normal retinal pigment epithelial. Yes. So, this is appeared as bull eye. Yes. After that, it can also precipitate porphyra. The enzymes, there are some enzymes which are used for the production of RBCs, and these porphyra, these enzymes will be increased. Okay. So, there will be accumulation of a particular enzyme porphyra, and that is leading for the inhibition of the further steps for the formation of RBC. So, that will be occur here, causes the decoloration of the discoloration of nails and mucous membrane. Yes, and for the pregnant women it can be given. Then quinine. Quinine drug is given when chloroquine is not effective. Yes. The combinations, it is often used with the doxycycline and clindamycin. Yes, to decrease the toxicity as well as to decrease the duration of therapy. Quinine is 70% bound to the plasma proteins and glycoproteins. Yes, there is a one problem with the quinine is it is causing hypoglycemia. Okay, that is why it is sometimes given with the sugar solution. So, hypoglycemia it is causing by palpitations, sweating, and there will be increase of heartbeat. Okay, tachycardia will be there. Now, see, to prevent hypoglycemia, what solution is given? 5% dextrose solution instead of normal saline. This solution is given. Now, if at toxic doses, means the drug is given for a very longer time, at the time synchronism will occur. Yes, and this synchronism leads to gastrointestinal distress, vertigo, blurred vision, headache, and sound in the ear. Yes, so tinnitus. It is also causing cardiac conduction abnormalities and the lysis of the RBC. Then mefloquine is given when the chloroquine is not effective. Yes, or chloroquine resistant Plasmodium falciparum infection. It is causing cardiac conduction disturbances, the same effects we have seen with the chloroquine and the quinine. Yes, psychosis and seizures due to peripheral neuropathy. Then primaquine is a very good drug which is used for many of these stages. Yes, it is forming some redox compounds, it is forming some free radicals which is killing the plasmodium. Yes, so it is working on the pre-erythrocytic stage as well as exoerythrocytic stage and working as gametocide as well, but it is contraindicated in pregnancy. There is also one problem with the primaquine, it is causing methemoglobinemia. Yes, and due to methemoglobinemia means this methane group is attached with the hemoglobin, and this is leading to many problems. CNS problem will be there, many severe effects will be there. Okay, so this need to be taken care. It has no role for radical cure in Plasmodium falciparum malaria, because in Plasmodium falciparum malaria there is no exoerythrocytic stage, no dormant plasmodium, phase is there. Yes. So, thank you so much everyone. I hope this is clear to all of you. Some of the drugs we have discussed here with the mechanism of action and their adverse effects where these drugs can be used. Apart from it, there are some other drugs as well. Okay. So, thank you so much everyone. I hope this chapter is very well clear to all of you.